Hi, Jim.
Hi, how are you? Dr. Sean Kondamuri joins us, and I'm Jim Dietlow here in the WJOB studios at Purdue. You can see the big sign in the background there, the Strachan Van Til Studios at Purdue. And every once in a while, we get together with Dr. Sean Kondamuri. A lot of people just call him Dr. Sean. And we talk about what's going on in his world. And let's bring him in right now. Doctor, how are you today?
Doing fantastic, Jim. How are you?
It's all right. It's a little warm, huh?
It's going to be warm for a few days, I guess.
Yeah, so there's things that we could talk about for that in a moment here. But doctor is with Midwest Interventional Spine Specialists, and you guys remember when we were doing this during the height of the pandemic in late March, April, May, just kind of hanging out. I think you guys got busy in a hurry, didn't you?
We did. We did.
Yeah, and doctor, remind people where your three locations are, would you please?
We are in four locations, Jim. We're in Munster, Indiana, Chesterton, Indiana, Dyer, and Hobart.
All right.
And we are Midwest Interventional Spine Specialists, and we take care of patients who have pain. We try to get them back to normal life, more normal, active lives.
You know, you look good this week. You got a good connection. You got better lighting or something. The whole
Better
thing.
lighting, yes.
Yeah, well, you got a little light, light hanging on the top there.
Yep, something like that.
Yeah, all right, there it is. Doctor, let's hit a few things before we get to the wellness and stuff. We started talking about spinal stenosis. I know that's something that affects a lot of people. And just remind people what it is and, how you guys address it.
Yeah, so the simplest explanation, Jim, for what spinal stenosis is it's a narrowing of the spine. If your spine is narrowed, if it's normally this big and it becomes narrowed because of osteoarthritis or because of an injury or because of a protruding disc or the term degenerative disc disease, any of those different things that cause a narrowing of the spine so that the nerve cannot come out freely, you're going to have pressure on that nerve and irritation, and patients will start getting pain, or tingling, or numbness in their back and legs. Usually they'll say they'll have pain and numbness or tingling when they're walking, sometimes just walking 10, 15 feet, sometimes walking, 100 feet, and they'll start getting, some patients will tell us, most of the time they'll tell us, oh, as soon as they sit down, that pain's a lot better. Sit with the rest, the pain.
So what causes it?
Yeah, the most common cause is osteoarthritis. There are other causes like tumors, some rare bone disease like Paget's disease. But the main thing is the most common cause for most of our patients is arthritis.
So the thing, your spinal cord narrows and you get a bunch of pain and it can shoot in a lot of different directions, or is it localized?
Yeah, no. So it can either be in the back, but most commonly it's down in the buttocks and down in the legs. So if it's going down into your legs, either your thighs only or down into your lower legs, it all depends on which level of the spine is affected. If you have an L5S1 or an L4-5 level affected, that pain may go down really low into your feet or lower legs. If it's higher up, it may only go down to your thighs. But depending on where the narrowing is, that determines where you might have pain.
All right. So what about like balance and grip strength and all that stuff? I mean, that goes into it or what?
That's very, very, that's very astute. Are you a doctor, Jim? That was fantastic. That's exactly some of the concerns we have. Patients who have stenosis in their legs, they may come in with just complaints of balance issues. They literally will sometimes stumble a little bit and they won't feel their feet the way they should. Or if it's spinal stenosis in the neck, cervical spinal stenosis, they'll tell us they're dropping things sometimes, so they don't have strength in their hands. They might have weakness in their hands and upper arms. So all those symptoms are also, all those features are also part of spinal stenosis.
What about jogging?
Jogging is sometimes going to be very difficult for a patient who has moderate to severe spinal stenosis. Almost impossible for a patient who's got advanced stenosis.
All right, so we talked.
Movement.
Yeah, I mean, there's certain movements and certain sports, right?
Yeah, so I think we mentioned last time some of the some of the basic treatments like physical therapy, use of anti-inflammatory medications like ibuprofen or naproxen. All those kind of medications are great to reduce the swelling and inflammation in the back. Sometimes muscle relaxants to relax your muscles so they're not grabbing your spine and making it kind of torquing to make that stenosis worse. But physical therapy is a key treatment. If those treatments don't help, then the patient's usually sent to somebody like me, and we might do some interventions. We call them interventions, which are different procedures. We talked last week, epidural steroid injections injections in the spine, put a steroid in the spine, and that steroid will, if it's put in the right place, we can take away that inflammation and open up the spine just a little bit so the nerve has just the freedom that it needs to give them relief. For many patients, that can give somebody relief for up to a year or even longer. I might see patients back every 1 or 2 years when they're at that stage. More severe, we have more advanced treatments for that.
So you're basically talking, is cortisone one of the steroids, or is that one of the early ones
really
used, right?
Exactly cortisone. Yeah, years ago we called it cortisone. Now it's really not cortisone, even though patients always think they're getting cortisone. I have to remind them that that's not what they're getting. We give them typically a medication called dexamethasone. And dexamethasone is a medicine that is very safe, considered like a second cousin to cortisone. It helps to take away inflammation without causing the swelling and the weight gain and some of the other side effects that people have. And the really nice thing about dexamethasone is that it's been proven to be very effective to reduce the effects of severe COVID-19, which is pretty exciting, I think.
You're going to have to. You're going to have to go back to that one about dexamethasone and its relationship to COVID-19, because that was not what I expected you to say. So what are you talking about?
I'll tell you. Let me tell you really interesting stuff, because at the beginning of COVID, like around March, April, we were worried about giving patients steroids, any kind of steroid, even by mouth or by injection in their muscle or injection in their spine, because we were worried that steroids would reduce the effect of your immune system. So if your immune system is not working, you can't fight COVID-19. You can't fight anything. So you don't want to have somebody on too much steroid, because potentially it would make the effects of the disease like COVID worse. But there's been significant data now, it's proven now, that we can give somebody dexamethasone as a form of treatment for COVID-19. So, us giving them dexamethasone for their back problem, indirectly, maybe it's helping them with their COVID-19. Who knows? But because we know for sure it's not unsafe to give somebody dexamethasone when they have COVID-19 illness.
All right, we're talking to Dr. Sean Kondamuri. If you have any questions about that, give us a call, 219-845-1100. So, I mean, how did people like? There are a lot of different things that are happening medically right now. It's like, oh, we didn't know this was going to happen, or there was a big article in the Wall Street Journal about the one immune doctor who started to notice that the tiny bubbles in people's lungs started making popping sounds, and how do you deal with that, and whatever. Maybe there's a way to just pop the bubbles or something. But it seems like the medicine's going pretty quickly. What's the progression here of people realizing that steroid that you put in the back actually might be helping their COVID, or at least won't be hurting it?
This is not conjecture anymore. It's a fact. I mean, infectious disease doctors using steroids in patients who have advanced COVID-19 lung disease. If somebody is looking very sick, they're going to give them a course of steroids.
And so, what, in your mind, exactly what happens?
I don't want to really guess what happens. I don't think we really know 100% why it's helping them. So I really would be much giving you an educated guess.
We're talking.
The fact is, if you look at the patients who receive it and patients who don't receive it, the people who receive it are doing better clinically.
All right, doctor. So these injections that you're talking about, I'm an upper 50s golfer, so obviously I know a lot of guys who have gotten the injections. Is it? I mean, I know golfers take it. I mean, and is there any other sports that it gets pretty prevalent in?
Well, because our golfers typically are, not always, but very often they're older gentlemen, or they're gentlemen who are retired, and ladies who are retired. We see a lot of those patients, and half of those golfers, are my patient already. Those patients are coming to me, telling me, Doc, I don't care what you do, just help me get back on the golf course. That is their primary motive. So we will give them injections like this, and for many of them, those steroid injections will get them back to walking and back to functioning for many, many months, maybe a year or longer, and we'll see them back again. But for some patients, we have to do more advanced things, and that's what we should talk about also. There's other options for the patients who have spinal stenosis that doesn't get better from injections, but it's not bad enough to have surgery, because surgery is sort of a last resort. We don't want to actually do an open surgery to cut away their bone and open up their spine surgically, because there are some risk involved, but that works. But that's something offered to patients who have more severe disease. When they're in between, we have an option, for example, called Vertiflex, or the Superion procedure. The Superion procedure is something for patients who have all those same symptoms, and they tell us, we notice that when they're bending forward, they have relief. When they stand up straight, they have more pain. So with the Vertiflex procedure, otherwise known as Superion, that particular surgery, it's a small surgery nonetheless, but it's not an invasive surgery like the decompression surgery. But the Vertiflex procedure is a device is placed inside their body, which opens up their spine so that now they don't have to bend forward to get relief. They'll have relief standing up straight. And if you can stand up straight and walk, that makes a big difference for patients, because most patients who have spinal stenosis will always be who have pretty advanced stenosis will be stooping forward, because that they discovered over time that helps to relieve the pain. Because if they bend forward, it opens up the spine just a little bit, so those nerves are free and they don't have pain. They discovered that on their own, and we know why that happens. So if we can put a little Vertiflex device in them, and that device looks something like this. Here's a plastic picture, a little plastic version of it. If you put that thing inside of somebody, this is plastic. This is not the real implant. But if you put this inside the spine, you can now open up those spinous processes and free up the nerves inside that area. It's a really nice option. In 30 minutes, we can provide these patients really good relief. They're walking immediately. They're very happy with it.
What do you mean 30 minutes? That's how long the
30 minutes
surgery?
Postoperatively, right after surgery. Aside from the mild pain they might have at the surgical site, they're walking up and down the recovery room, standing up straight and feeling really happy, very happy.
We're talking to Dr. Sean Kondamuri of Midwest Interventional Spine Specialist. My grandmother, before she passed, used to call herself a stupid old lady because she said that, walking forward, her back didn't hurt as much. So I guess I never really thought why. I thought she was just an old, was 90 years old or whatever. But Doctor,
it's so common. We have a clinical sign for it. We call it the shopping cart sign. Patients will say that they go to the grocery store just so they can lean on a shopping cart and push around and walk around the grocery store, because leaning forward on the cart helps them.
And then they wind up.
It's almost diagnostic.
Yeah, and then eventually, sometimes they might wind up with a walker that would do some similar things. Yeah. So, Doctor,
Exactly.
all right, let's go through this again. You start with physical therapy, and then maybe some of the anti-inflammatories, right? Then you go to
Correct.
a steroid would kind of be the next level, and then this Vertiflex is another one, right?
Vertiflex.
Yeah, and then are there any others ways to deal with stenosis?
I think that's one we should talk about, because after that it gets a little more complicated. That's a simple one for our audience to understand, because it's a simple procedure that gives patients long-term relief. It's a permanent solution with very minimal complications. It's done with monitored anesthetic. You don't go completely to sleep with it. It's either local anesthetic or IV sedation, and patients can do really well. So I think that's probably the best thing to talk about when you're in this forum. There are a little bit more advanced surgeries that we can offer them that aren't quite as big as the infusion that sometimes is done by the spine surgeon. But this is a really good thing to talk about.
He's Dr. Sean Kondamuri, Midwest Interventional Spine Specialist. I know we kind of went pretty deep into it, and if you have any questions, obviously you just get a hold of Doctor and get an appointment and go in and see him at the Midwest Interventional Spine Specialist, 4 locations, but Hobart, Chesterton, Dyer, Munster. Did I get that right?
Yes.
Yes, I got it. I think I finally got it right. All right, Doctor, anything else on that you want to talk about?
Not a whole lot. I mean, I would say also, when patients have arthritis in their spine causing them stenosis, there's a lot of times that they have other conditions going on at the same time. The arthritis can affect the joints, and they can get pain from the joints. So there's some treatments for the joints that we offer patients to help relieve that pain. So it depends on where it's coming from. But arthritis, Arthur is not a friend of yours. I mean, arthritis can really affect a lot of different parts of your spine and your whole body, but especially different parts of your spine. And depending what the problem is, we have solutions for those problems in most cases.
All right, Doctor, let's move on to some things. As you guys well know, that doctors just, not just spine and pain and that kind of stuff, but we haven't talked in a few weeks about kind of the progression of where COVID is and so forth. And one of the things that is going on right now is that a lot of athletes have been sitting around, they haven't really had any contact, and then all of a sudden they're going to have a bunch of contact in their sports. Soccer, volleyball, mostly soccer and football right now are kind of going at it pretty hard. I mean, do they present with any specific risks out of kind of coming out of like being off for a long time and then all of a sudden going into competitive situations for their spines?
I don't think it's really COVID related, but I think what we're talking about here is just the typical issues that any athlete's going to have if he's not in good shape. If he's not flexible, he's going to have a high risk of injuries. And they might just be muscle injuries, muscle pulls and strains and sprains. Those are serious, right? I mean, that can really set an athlete back, and he can even be out for the season if something like that happens. But those are not exactly COVID specific. They're only related to the fact that they've been training for these many months because of COVID. But I think a lot of our athletes have been at least training for the last 1 month, through the month of August and the end of July. They've been training, and hopefully they're young and healthy, and they are able to get back to, close to their normal fighting state.
I guess I'm just curious, doctor. I mean, it seems like everybody has a kind of a slant on whether we should, like the Big Ten canceled football, and they just up and canceled it, and they're getting a lot of pushback right now. I was just wondering, do you have any general thoughts on that?
I mean, it is very controversial. We know the NBA and the MLB, they're playing their sports in empty stadiums. They're testing them frequently. They're kind of segregating all the players so that they don't get in contact with the general community. So it works in professional sports. And I think they could have taken that risk, like at Ohio State and some of the other universities. Obviously, they took all considerations into account because they're losing tens of millions of dollars, maybe hundreds of millions of dollars for a place like Ohio State, for example.
Billions of dollars for the Big Ten in general, yeah. Isn't that crazy?
Yeah, it's a lot of money. So, I mean, they didn't take this decision lightly. They looked at everything that they thought they would do. I think that when I see our high school sports teams, they're playing football, taking a lot of precautions. I mean, I think you've talked about some of those, how they're not huddling, and you're not really, the huddles are a little bit modified. They're the back row is speaking over the front row, which is bent forward, so they're not getting directly in contact and breathing on each other. And the quarterback or whoever's in the middle of the huddle is talking over the players, so they're trying to avoid direct transmission of particles into somebody's face. We'll see how it goes. It's hard to say what's right and what's wrong. This is all somewhat controversial stuff. I think every school district or college has to make the decision on their own.
Doctor,
they don't want to get it wrong, though.
Oh, yeah. That's the key. What's the, if we could go into what could happen if they do get it wrong. But, Doctor, a lot of what you've talked about in the past is, obviously we talk a lot of spine and pain stuff, but we also talk about general wellness and, what people can do during a pandemic. I get callers on my shows and stuff like that are like, oh, my gosh, I'm getting overweight. Oh, my gosh, my joints, I can't walk out. I had a guy today, oh, my leg, my knee, it never used to be that way. I'm wearing a larger size shirt. In general, with your patients, I mean, are you seeing some of them got, what's their general state of health and their attitudes these days?
Well, I think that what's happening now with COVID-19 is you just have an exaggeration of problems that already existed. Let's just put aside what the COVID body, from the COVID-19 point of view, the way COVID-19 has affected our lifestyle, aggravates or exaggerates everything else we're doing wrong. And one of the biggest problems I see is, you mentioned how it's going to be hot again, and it's going to be hot for the next several days. So it's hotter, people are going to get dehydrated. When we talk about dehydration, you got to understand it's not just dehydration when it's 95 degrees outside. You're probably dehydrated when it's 80 degrees outside, because we just don't hydrate enough. And if you don't hydrate yourself, you're looking at lots of medical problems. And I think that if there's one simple thing I could tell all my patients and my friends is drink a lot of water, drink a lot of fluids, drink a lot of food that contains water. Eat a lot of food that contains water, because that's somewhat easy to repair, and people don't think about it. I mean, if you've got that brain fog in the morning, if you're feeling confused, if your older patients are feeling confused and dizzy, that's dehydration. If your joints are stiff all the time, that's partly dehydration, partly. If you drink coffee only and not water, you're probably dehydrating yourself a little bit more. You need to drink just water or sports drinks that have some electrolytes in them, or add some electrolytes in them. They're electrolyte palatable, and it will make such a big difference. I mean, literally, Jim, if you look at the dehydration research that's out there, if you don't hydrate yourself well, your blood is actually thick. If there's a normal viscosity or thickness to your blood, take away some water, and what happens? That blood's just a little thicker and it's more sluggish. And that can become a problem if you've got heart disease, or if you've got narrow blood vessels into your brain. You have a risk of strokes, you have a risk of myocardial infarction, you have a worsening of hypertension, you have a worsening of diabetes. If you're diabetic and you're dehydrated, anyone will tell you, or at least they should know, that if you don't hydrate yourself, you're at a risk of something called ketoacidosis, where your sugars get really high and you end up in the hospital and potentially even die. So hydration is such a big, important, simple thing we can do that people don't really pay a lot of attention to.
Talking to Dr. Sean Kondamuri. If you've got any questions about any of this, Doctor, that's especially important right now as we're talking at mid-90s the rest of the week here. I just worry about. Go ahead.
If you just carry a water bottle with them, how many people even carry a water with them to work? This should be with you all the time. This water bottle, and I have a water bottle sitting on my desk here in the office. I have a water bottle over there where I'm seeing patients. I have a water bottle in my car, and I've got some sports drinks in my car, and I'm drinking at home. Drink something you like to drink that has a flavor if you want. Put some lemons here if you want to make it a little bit flavor, make it more flavorful. But you just have to have it around. Because if it's around, you'll go 5 hours without drinking.
Yeah, I agree. Yeah, people just sit around and don't drink anything, and I'm one of them, so I don't know why I'm smiling and going on it. Doctor, we talk a lot about issues and health issues and stuff. What do you do to stay in shape?
I try to hydrate, like I just said. I try to work out, and I try to exercise regularly.
What kind of exercise?
Well, so I like to do at least twice a week. I like to do some resistance training, some kind of weight training. So I used to go to the gym. I used to go to Omni until like March or April, whenever Omni closed. I stopped going there, and I haven't re-upped my membership. I've got it on hold. But I'm still a little concerned about going to a fitness center. I don't know how well they're cleaning everything. So I stay away from it. So I work out at home, and I go to another gym, a small gym where I have a personal trainer who helps me just to weight train. Because I'm older, I'm your age, Jim, we're both the same age. We have to do work with muscle training. You've got to do resistance training, especially when you're in your 40s or older. So we may not want to look like Arnold Schwarzenegger, but we want to be strong. We want our muscles to be toned, because if you don't have strong toned muscles, you're going to develop more osteoporosis. If you need those muscles to pull on the bone to prevent osteoporosis. If you develop osteoporosis, you can have a hip fracture. You can have a lot of fractures that'll really set you back. I don't want that. So I do a lot of work with weight training, and specifically I do training work that is more related to stability and posture. I like to say, I told my trainer that I want to look good, of course. Also want to be strong in the right way, but strong so that I can do normal things. I can do things that are important for me. Like if I'm traveling, like in 10 or 20 years from now, when I'm even older, I want to get on an airplane because I want to keep on traveling now and then, and I want to be able to put that suitcase up on top by myself. So I need to do something like that. When you're 50, 60, 70, you want to be able to get on the ground and get up when you're with your little grandchildren. I want to be able to pick up a little 20-pound or 30-pound grandchild who comes running at me. I want to be able to pick them up. So these sort of core exercises or different kind of weight training that are very practical is what I'm looking at. And I want to look good. That's definitely part of it. So that's the weight training.
No, but I mean, I guess, I never think of like those very practical things. I think of like getting on my bike like I'm going to here in a little bit and ride for 20 miles. And then that's a lot of fun.
Well, and that's a great amount of fun. And that's what I do for my cardio. My cardio now is cycling. I think we've talked about that, Jim. Yeah. I like to cycle. So I'll cycle 20, 30, 40, or 50 miles on a weekend especially, and on weekdays 20 on weekday mornings. But cycling is a great exercise for people with bad knees or bad hips, because you can cycle and not really put stress on those joints. So those joints are now somewhat protected. I really can't run anymore. My knees have pretty much had it from all the running I used to do. So cycling's a great way to go. You can ride hard to really, if you want to work your body, you can get a high intensity workout. You've heard of HIIT, high intensity interval training. You can do that on a bike. You can do that with running, but a bike is very easy to do. But again, we got to be careful because you don't want to fall. That's, that is a concern. I have fallen once. I broke my clavicle. I don't want to do that again. So we have to be careful.
He's Dr. Sean Kondamuri with Midwest Interventional Spine Specialists, 4 locations, and he's always thinking about the body and your body. So, Doc, thanks for sharing some of your wisdom today. Anything else?
One more thing, Jim. One more thing. You asked me what else am I doing? I think it's important to mention the body's important, but it's also the mind and the spirit. I would encourage our viewers to think about meditation. Think about something to relax your mind, because the stress of all this is what really is difficult. And that if you can relax your mind a little bit, free your mind up a little bit from all those stressful and anxiety-producing thoughts, you'll sleep better and you'll be able to handle the stresses better.
All right. Well, why don't we start with that one next time? How's that sound?
That sounds great.
Yeah, we'll start because I have no idea how to do that, and maybe you'll give us some tips on how to get there. Thanks a lot, Doc.
We'll talk about that. That'll be great.
All right.
Thank you, Jim. Have a great day.
You too.
Bye.
That's Dr. Sean Kondamuri there, Midwest Interventional Spine Specialist. He's a sponsor here of that stuff, and we appreciate him doing it. Let's see here. Where are we at here? I'm going to end the video now, guys. And I'll continue on the radio here, all right? There it is. And we will end here.